Okay, so I've been meaning to do this for quite a while, and to be honest, it's been basically because I've been lazy. So, but I owe this to Dr. Pearson and to everybody at Affordable Dentures in Wilsonville. But I wanted to wait until I went through this whole process and I was pretty much all healed and used to my dentures and everything else because I figured that way I'm going to be able to give the best review, I guess. But this is more than a review. This is kind of a general thought of the whole process. So July, I can't remember the day. I think it was right after the 4th because we ended up getting back from our vacation. Then I went and did this, and I didn't want to have to go through the initial process of this, during our vacation or before. So 2 years ago, 2.5 years ago, this is September, so 2 years, 2 months is when I started this. And I guess the first thing I have to say is you need to think about why you're thinking about getting dentures. And this is what I came up with, and I tried to have this attitude from day one. Obviously, my teeth were shot. I didn't take care of them. Part of it was, I think, really bad dental practices on some of the dentists that I visited when I was younger. There was some stuff that went on that just was mind-boggling, but that doesn't matter. I ended up with teeth that were just trashed, and I was going to post a video along with this of before and after, but I think I've just kind of decided, well, I don't know if I have one, but I'm just not even going to take the time to look because ultimately it doesn't matter. I need to get it done. But my number one piece of advice, I guess you could say, is you need to come up with, well, not need to, you should probably realize that this is not a replacement. These will not, I don't believe anything that you get done, or at least as far as what I've gotten done, is going to be a replacement. This is an alternative. I got sick and tired of the toothaches, especially on the weekend when I couldn't get a hold of anybody or get pain pills. This is definitely not a replacement. This is an alternative to what I had before. Couldn't really chew food, just the embarrassment of crappy looking teeth. And just, I had to do something. So my plan was I was going in. I wasn't going to be El Cheapo as I normally am in everything in my life. So I decided I was going to do it, and I was going to try to do it the best that I could. So I looked up and I found Affordable Dentures in Wilsonville, Oregon. It was Dr. Annette Pearson, who is awesome. We'll get more into that in a little bit, but she's awesome. Everybody there is really awesome. I have nothing but good things to say about them. So I went in, got my initial consultation. They did X-rays, talked to Dr. Pearson, answered every question I had. Took the time. Never in 2 years of going there ever did I feel like get me in, get me out. They were done with me, or they just wanted me out the door. They were always fantastic, answered my questions, and I was a pain in the ass. I really was. But I tried to go in with a good attitude and make this the best experience that I could. So I ended up getting 17 extractions. My plan was to get all mini implants when I started. So I had the root, and that root, the bone preservation, where they actually put cadaver bone in the holes, and you have to wait. I believe it was a year I waited, and that bone grows back in the hole, or the holes. So, and plus I just didn't want that jawline problem as I get older. I'm ugly enough as it is. I don't really need any help. So I had the preservations done, 17 of them. Went in like a year later to make sure that was all growing good, and it was. I'm pretty sure it was a year. It could have been 6 months, but this is a long process. This is not going to happen overnight. It's just not. So, had the extractions, the preservations, and got my initial dentures that day. I posted some videos the day when I got back, or the day that I got back, and then 8 or 9 videos through the next couple months, and I just kind of fell out of it. Wasn't really thinking about it too much. I was feeling better, able to eat better, and so I just kind of moved on with life. So I ended up going back in. My plan was to get mini implants on the top, mini on the bottom, and to help stabilize, because of all the reading. I over research things extensively, and so I wanted to get rid of the gluing the lower denture in, because I heard it was just a pain. So if anything, I was going to get the bottoms, but I had planned on doing tops and bottoms. So after thinking about it, getting questions answered by Dr. Pearson and a couple other of the staff there, which they're all awesome, I decided that it was really best to go with the full-size implants. That kind of greatly reduced the number that I could get, so I ended up with 3 on the bottom, full-size implants, and none on the top. I had a financial situation that came up, and I actually needed to cancel the top, which it is what it is. Not really the perfect scenario. I would absolutely love to have the top done, because the bottom it's awesome. I tell you, if you've gone through the process of gluing in dentures, it sucks. I mean, just no plain thing about it, or no complaining about it. It is what it is. It's going to be something different that you're probably never going to get used to, and it's horrible. If you can do anything, if you're thinking about implants and you're going to do anything, get the full size on the bottom, because they snap right off, and no glue. They hold great. I can eat pretty much anything. The top, I was really hoping to get rid of the palate. A lot for the taste of food, and for ice cream, and hot and cold, because you just can't feel it on the roof of your mouth. But life is what it is, and stuff happens, and I don't have the top. My plan is to go back and get it done. It's not easy to save the money as I thought it would be. But whatever, it is what it is. Apples out of oranges, or however they say it. So, and I got the ultimate dentures, which I hope I'm doing this in the right order, not bouncing around too much. The ultimate dentures, they were $2,000, I think. Well worth it. Well worth it. The top fits so much better than my initial dentures. The immediate dentures is what they call them. The ultimate denture, the fit is so good, and I'm what am I? I think I'm about 8 months after um, all my implants. Yeah, I think I'm about 8 months. So I've had my ultimates for about 8 months, and the top isn't glued in right now. I can eat pretty much anything. Steak's kind of a bear, and some stuff when I really have to clamp down, they'll pop out. But if I glue them in, you're golden. You're golden. The ultimates have that good of a fit, and everything changes. Some days are different. Some days it's not perfect or as perfect as it can be. But I just that probably your blood pressure. Who knows? I mean, there's probably 20 different things that affects that. So I'm really happy. So now the whole reason for this video is Dr. Pearson and ultimate or affordable dentures in Wilsonville, Oregon. Um, if I'm going to do any more, which I plan to, she's the only person I'm going to. Absolutely. I have nothing to base it against. I have nothing to compare it to. The only thing I can base it on is my experience that I had with them. And it's the only time I've done it. So, like I said, nothing to compare it to. They're awesome. You need to realize that everything isn't perfect. We don't live in a perfect world. These people have gone to school for who knows how many years, gone into debt, have school debt, and really applied themselves to do this for whatever reason. They're good at what they do, but you have to keep in mind that nothing is ever perfect. If I could change anything about my experience with them, it would be nothing, because I try to be a realist in the fact that you need to kind of make the best you can with everything. When I had my 3 lower implants done, they hit an artery or something. They said it hadn't happened before. I went home spewing blood out. It wasn't a huge deal. I got a hold of them. I went in after hours. Luckily, I got them right before they left, but I went in. They were a little surprised by it. I didn't make a big deal out of it. They tightened up, loosened some stuff. It was fixed. The implants did hurt quite a bit, but it's fine. I mean, stuff is going to happen. No matter who you go to, you are not going to go and have a perfect situation. Everything is not going to work out perfect. It's not. And if you're expecting it to, don't do this. Don't. Just do not do it. If you want to have better health, which is one, and just overall better experience with life, go do it. I highly suggest it. However you can do it, however you can pay for it. If you can get the implants, get them. Absolutely. At least get them on the bottom. Part of the problem with getting them on the bottom and not the top is you want them in the top so bad it's painful sometimes. But it'll happen. I'll make it happen. It'll work itself out. It's just I've got to believe that it will. So look them up. Go talk to them. Go down and ask questions and talk to them. And that's all you can do. They're gonna be great. They're gonna help you out through this thing. But you need to realize too that they do a lot of these, and it was kind of like I was a little bit sad when I was all done, because I used to go down there and I love laughing with them and making a joke, and it's all about what you make of the experience. And to be honest with you, I actually really enjoyed going down and seeing them, because it was a good experience. But I'll be back to see them. So check them out, talk to them. Absolutely get yourself in the right mindset to do this and make this change in your life, because I'm really glad I did. I'm really glad. Ultimately, it's not what I was striving for in life to end up with dentures, but is what it is. Got both my legs and arms, so what am I complaining about? Um, anyway, probably not exactly how I wanted the video to go, but I just decided that it's time to stop procrastinating and get this done, because I do owe it to them. I think I went into the best place and I got the best experience that I could, and I am 100% happy. It definitely was the right place to go. So if you go see her, tell Dr. Pearson I said hello. Tell her Troy sent you. She'll remember me. And have a good day. Good luck. Thanks.